Hello everyone, it's Satara and today we're going to be talking about type 1 diabetes. Type 1 diabetes, also known as juvenile or insulin-dependent diabetes, is a chronic condition in which the pancreas produces little or no insulin. Insulin is a hormone needed to allow sugar, or glucose, to enter cells to produce energy. While the root cause of diabetes is unknown, research shows that type 1 diabetes is considered to be a progressive, inflammatory, autoimmune disease in which the immune system begins to attack and destroy the islet cells, groups of cells located in the pancreas that make hormones that help the body to break down and use food. As the body's immune system destroys the islet cells, the beta cells, located in the pancreas that make insulin, also become damaged. Once a significant amount of the islet cells are damaged or destroyed, the body will produce little to no insulin. The islet cells, cells that work to contribute hormones, usually remain unaffected. However, the reason as to why there is an autoimmune attack on the beta cells remains unknown. Research has shown that there are a variety of different contributing factors in the development of type 1 diabetes, including genetics and exposure to viruses and other environmental factors. Common signs and symptoms of type 1 diabetes include excessive thirst, more frequent urination, unexpected weight loss, increased hunger, blurred vision, and unusual tiredness. While the development and diagnosis of type 1 diabetes can be prevented, it cannot yet be cured. However, the good news for those diagnosed with diabetes is that there are effective treatment plans and ways to manage it. Due to the evolution of medicine and research, we are continuing to further our studies and are learning even more information about diabetes and how it can be regulated. In most cases, for those diagnosed with type 1 diabetes, insulin is used. There are now multiple different forms of insulin injection options, including the pump, a tiny computerized device that supplies insulin at the touch of a button. Oral diabetes medications, also known as oral hypoglycemic drugs, are another treatment option that are used to help lower blood sugar levels. The most common oral hypoglycemic drug is metformin, which helps the body to reduce the amount of sugar it takes from food, the amount of sugar that the liver makes, as well as helping the body respond better to insulin. There are dietary implications that go along with the diagnosis of diabetes. Once they are understood, dietary management becomes much easier. Knowing what your body needs when blood sugar levels are running high or low will greatly influence your dietary decisions. Making constructive food choices can be an effective individual treatment plan. The prevalence of type 1 diabetes continues to grow each year due to higher obesity rates and health issues in younger adults and children. While this is not to blame entirely for the increase in the prevalence of this disease, it seems to play a major role in raising these numbers. In 2015, 30.3 million Americans, or 9.4% of the population, had diabetes. Approximately 1.25 million American children and adults have type 1 diabetes. 1.5 million Americans continue to be diagnosed with diabetes each year. Untreated type 1 diabetes can lead to diabetic ketoacidosis, a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones. Diabetic ketoacidosis often develops when your body can't produce enough insulin. Over time, diabetes complications can affect the body's major organs, including the heart, nerves, eyes, kidneys, and blood vessels. However, maintaining a normal blood sugar level can dramatically reduce the risk of many complications associated with type 1 diabetes. While diabetes can drastically impact someone's life, once it is understood, individuals diagnosed with this disease can live long, healthy, happy lives. Researchers continue to search for more information on diabetes, in hopes of aiding millions in the present and future by finding a cure.